Now, we don't know what the future of COVID will bring. No one does. Globally, cases remain higher than any other point in all of 2020 and 2021. Europe in particular has been a confusing picture of some countries with increasing cases, others with decreasing or steady cases, with the influence of that BA.2 variant. And as I mentioned, our own local trends are flattening rather than continuing to decline, with an uncertain future ahead of us. And meanwhile, we see what appears to be the beginning of an increase in disease burden in the northeastern part of our country, particularly watching a doubling of cases recently in New York City over the last couple of weeks. And we should understand that these trends may well shift to our own region very soon. So where does that leave us as a community? Well, right now, with relatively low cases, hospitalizations, and deaths, it leaves us in a position to take a breath, but at the same time, to take advantage of that reprieve to prepare. So first, to prepare as a community, to ensure that we have the capacity to rapidly increase access to testing, to vaccination, and to new therapeutics when the next increase in cases eventually occurs. And it's important to note that community preparation will only be hampered, particularly for vulnerable populations, as national level funding for the uninsured recedes. Now, second, to prepare as individuals. While mitigation measures are not as critical for everyone at this point in time with low disease burden, vaccination remains as important as ever. Now, getting vaccinated in the middle of a surge does quite little to protect you in the short term. But getting vaccinated and boosted right now, before another rise in cases comes, can help to ensure that you have the most protection possible with an uncertain future.